Buoy Health Insights. Back pain, worse straightening it. Welcome to Buoy Health Insights, where we delve into common health concerns and explain them in a way that's easy to understand. Today, we're focusing on a type of back pain that gets worse when straightening it. If you've experienced this, you're not alone, and understanding the potential causes can help you find relief. Let's break down the potential causes of this symptom and what other indicators might point to each cause. Mid-back bruise. A mid-back bruise happens when the tiny blood vessels under the skin, like capillaries and veins, get damaged. This causes blood to pool under the skin, making the bruise look blue or purple. You may have a bruise on your back if the area is swollen or has changed color, especially after an injury. The best way to deal with a bruise is to rest, do gentle exercises as you can, and apply ice for 10-20 minutes at a time. Mechanical low back pain. With sciatica, when you have a sharp pain shooting down your leg starting from the spine, it might be sciatica. This can happen when a disc in your spine, which acts like a cushion, slips out and presses on a nerve. If you're feeling weakness, numbness, or a tingling sensation in your leg, sciatica might be the cause. Treatments can include things like physical therapy, medications to reduce inflammation and pain, and sometimes even injections or surgery to relieve pressure on the nerve. Low back strain. If you've lifted something heavy or played sports and then felt a sudden pain, cramping, or even heard a pop in your lower back, you may have a low back strain. This means you've stretched a muscle or the tissue connecting muscle to bone too far. To heal from a low back strain, you can rest, use ice packs, and take over-the-counter pain relievers. It's also important not to stay still for too long because moving helps your back get stronger and heal. Herniated disc in the lower back. Herniated disc, sometimes called a slipped disc, occurs when one of the discs in your spine is pushed out of place. This can cause pain, weakness, or a tingly feeling in your back and legs. Risk factors include aging, which dries out the discs, as well as smoking, obesity, and not being active. Treatment can involve rest, medications, therapy, injections, or surgery. Fibromyalgia. This is a chronic condition with symptoms like widespread pain, fatigue, and sometimes depression. If you're experiencing deep tenderness, have sleeping problems, or feel more sensitive to temperature, light, and noise, fibromyalgia could be the reason. There's no single test for it, but if these symptoms persist for more than a few months, a doctor might diagnose you with fibromyalgia and help you manage symptoms. Chronic low back pain. Finally, if your back pain has lasted over 6 weeks, it might be classified as chronic. Often, the exact reason isn't clear, but it can result from ongoing strain to your back muscles or bones. Chronic pain can be managed with exercises, medications, and staying active rather than resting too much, as that can worsen the pain. In some cases, like with ankylosing spondylitis, where the joints in your spine become stiff and fixed due to inflammation, the lower spine becomes inflexible. Now let's talk about when you should seek medical care. If the back pain is accompanied by symptoms like severe weakness, problems with controlling your bladder or bowels, or incredible pain that doesn't improve with rest, it's important to see a doctor right away. Remember that each condition can carry additional symptoms that would indicate you have that specific diagnosis. For instance, if you have fibromyalgia, you're likely to also experience chronic aching or pain in the muscles alongside fatigue. In closing, we want to emphasize that while understanding the potential causes of your back, pain is important. Seeking professional advice is always best. Take action towards a healthier back, and if you found this video helpful, please give it a like and subscribe to our channel for more health insights. Your well-being is worth it.